What happens when Wall Street buys a hospital? Patients pay the price. Investors don't see patients, they see dollar signs. But what impact does this have on the ones lying in the hospital bed? For-profit hospitals owned by private equity have about 25% higher rates of falls, infections, and other adverse events, worse perceived patient experiences, higher mortality in the emergency department and critical care units, and higher overall adjusted mortality when compared to nonprofit hospitals. It's also not a surprise that nursing homes owned by private equity are associated with more potentially avoidable ED visits and hospitalizations. And let's not forget higher costs. So let's tie this in with what's going on in healthcare. The nurse-patient ratios increase so they don't have to hire as many staff. Job layering stacks additional burdens and responsibilities on the nurses to increase profit. Again, because if they can get the nurse to do it, then they don't have to hire more staff. Nurses try to act as a shield to protect the patients, often working at frantic paces to keep up with being overloaded so the patients don't suffer. But what happens is the nurses and the other healthcare workers end up suffering. They become burnt out quickly and leave bedside. This really high turnover leads to bringing in newly licensed nurses because the hospitals and facilities cannot retain highly experienced staff. Have you ever seen a nurse with 6 months experience acting as charge nurse on an ICU to nurses with 1 to 2 months experience? If that doesn't scare you, it should. And I'm not bashing new grads. I'm bashing the system. The bottom line is, when private equity takes over a hospital to make profit, it's the patients and the families that suffer for it. The hospitals should be answering to patients, not stockholders. If you enjoyed this video, like, share, and follow, and thank you for watching.